Hello, my name is Dr. Kasia Kine, CEO and founder of EBV Global Institute, and today we talk about zinc. I think people are more versed about zinc because of COVID, and it's a good thing. Zinc is pretty amazing, and if you have chronic EBV, you can't go without it. So let's talk about its profile, how to supplement, why is it important, what actually does it do for EBV. It's an essential nutrient. It's a mineral. It means essential means we don't make it internally. We have to take it from food. Moreover, the body doesn't have a way to store it for later. So you have to get it daily. And some studies suggest that even up to 70% of US population may be mildly deficient. We're going to talk about some signs of deficiency. So you can say, do I have a zinc problem? Zinc is involved in many enzymes, more than 100. It is needed for so many functions. Let me list just a few. Insulin function, tissue repair, tissue growth, vision, neurotransmitter functions, protein synthesis. Adequate levels for normal are needed for normal sense of smell and taste. It's also involved in the DNA synthesis and cell division. You can Google zinc fingers if you want to learn more about that. And then what about EBV specifically? Well, in general, zinc is well documented for its antiviral effects. Specifically for EBV, it inhibits NF-kappa B. I have lots of trainings about NF-kappa B, some other video trainings you can hear about it. Much more in depth. But NF-kappa B basically is the virus's preferred vehicle to replicate. The more of it you produce in the body, the more EBV can hijack it and replicate itself inside it. So again, zinc inhibits NF-kappa B. Interferon gamma is very important when you have EBV, and zinc is one of those agents that can improve efficacy of interferon gamma tenfold. It's very important. We know from research that increasing interferon gamma also increases viral defense. And interferon gamma is one of the key antiviral mediators in your body, and is central to elimination of viruses from central nervous system. And sometimes EBV is literally in your head, in your brain. Immunity. Zinc is very famous for its immunity. It's a building block of thymolin, which is made in thymus, maturation of your T helper cells, very important immune cells. So it supports the immune system. So zinc supplementation can literally restore thymolin from the undetected levels to chronically infected zinc deficient patients, with a corresponding restoration of immune function. That's a study quote right there. Remember that restoring the immune function is key to keep EBV in check. Excuse me. Zinc prevents viral replication, even in such simple therapies as oral zinc lozenges for infections like flu. Yes, oral zinc lozenges are very effective. Short-term daily zinc is a must for any viral infection, but for long-term chronic EBV, zinc supplementation becomes a daily necessity longer term. Last but not least, we know, and you probably heard me say it in other trainings again and again and again, that we want as many antioxidants as possible, because that's one of the key things that the virus hates. The more antioxidant value we have in different agents, the better their function against EBV. And zinc is an antioxidant. The same with inflammation. It's an anti-inflammatory agent. So when you are deficient, like I said, it's not uncommon. It can have a profound effect on your immune system beyond the thymus that we discussed. It causes depressed peripheral T lymphocytes, T cells, T-cell mitogen responses, NK function, decreased ratio of CD4, CD8, decreased interleukin-2, IFN gamma, all of which favor viral infections. So let's talk about how you know if you have zinc deficiency. First of all, it's depleted in stress, and people with chronic EBV typically have a lot of stress. That's often the tipping point for EBV. You don't taste or smell foods as well as you used to. And you may have low stomach acid, hypochlorhydria or achlorhydria. Some of the practitioners in functional medicine even use a supplement called Zinc Challenge. It's a liquid zinc that you can put in your mouth and hold for 20 seconds and see if there's any acuity of flavor, taste, or not. Very old remedy to see how good or how bad your zinc status is. Severe deficiency, delayed healing of ulcers, neurosensory disorders, infections due to immune dysfunction, weight loss, skin inflammation, baldness, diarrhea, emotional disorders, and even sexual underdevelopment in males. That's pretty severe. Moderate deficiency, growth retardation. This is really huge. Moderate deficiency. Delayed wound healing, again, neurosensory changes, rough skin, poor appetite, and mental lethargy. Now, mild deficiency, decreased muscle mass, neurosensory changes already, inability to react, sluggishness, decreased immune function, of course, decreased sperm count and testosterone. One of the first things in males that are trying to have a baby is, what is your zinc status? You can't have healthy sperm without it. Of course, with a mild deficiency, your taste and smell acuity drop. You have poor response to stress. Then I will add white spots on the fingernails. You won't see any on mine. The last time I found a white spot on my fingernail was when I was moving and I was not eating very well because it's stressful. All right, let's talk about dosages and forms. Zinc can come in liquid. Ionic liquid is actually really nice. And it has different minerals with it. It's good, especially when you supplement long-term, to have a little bit of copper, because if you supplement long-term with higher doses of zinc, you can induce copper deficiency. So we have a formulation that has a little bit of copper, good ratio, so you can supplement every day. Ionic liquid zinc is available in supplements, but we found in our community that even I found, I don't know what it is in this formulation, but I even threw up. You get nauseous, you throw up. It's just something about the zinc liquid that did not sit very well with any of us. So as much as I want to say, you know, people can have pill fatigues when they have to pop all these supplements in capsules, zinc is easier in capsule form. So that's what we use. And you can go to our website, ebvhelp.com. And you're going to see the bundle, EBV bundle, and zinc, our preferred zinc is right there. On our website, the same website, we also have the lozenges that I love. Lozenges typically are 5, 15, 25 milligrams, depending. The one that we use is immunozinc with a hyphen. So that's on the same website, ebvhelp.com. Like I said, you know, lozenges are very well studied because when you suck on them in your mouth, you have your tonsils right there. You have exposure to zinc right in your oral cavity. And oftentimes tonsils are involved with EBV. You know, you need that immunity, that immune support right there in your mouth. In terms of capsules, I would say upper limit daily is 40 milligrams. You can do 50, 75 milligrams in capsule for a few days, like acutely, maybe 2 days, and then drop to, you know, 40 maybe. If you overdo, your toxic levels from oversupplementation can cause nausea, vomiting, stomach pain, flu-like symptoms, and again, changes in taste. Sometimes excess of supplementation of a nutrient has very similar symptoms as deficiency of that nutrient. The zinc is a mineral. Minerals like to be absorbed better with food, unless you take lozenges and you just, well, you don't want to mix it, in your mouth with your food. All right. So one more thing I'll say is calcium and iron supplementation may decrease zinc absorption. So be mindful if you have a bundle of everything together. And certain antibiotics and rheumatoid arthritis medications and some diuretics may interfere. So you may want to take those 2 hours away. You may want to check with your doctor. So there we go, a little zinc. Yeah, I actually want to show you a little lozenge. I'm going to take it in a moment. So yeah, lozenges are available in stores, but the good brand that we have in a higher dosage, 25 milligrams, is on our website, like I said. Hopefully this is helpful and you can actually feel so much better just by taking this little zinc. Thank you so much, and I will see you on the next training.